Bacteria that can't be treated with drugs has become a major concern. 1 in 20 hospital patients end up with an infection, according to the Center for Disease Control and Prevention. But tonight, NBC Charlotte anchor Kelly Patterson shows us how North Carolina's medical community is working on a killer robot to wipe out those germs.
It may not look intimidating, but that's a killer robot being rolled through the halls of Durham Regional Hospital. It's called True-D, or Trudy.
Trudy is 6 feet tall.
And its target
system is active.
Is bacteria.
Human touch only cleans 50% of the room.
5 seconds, exit the room now.
Check this out. Durham Regional Hospital is one of 9 participating in a 28-month study led by Duke doctors and sponsored by the Centers for Disease Control and Prevention to see if Trudy's UV light technology can kill the big 4 drug-resistant germs that lurk in hospital rooms. MRSA, C. diff, Acinetobacter, and VRE are the 4 germs being targeted for this study because of their ability to live in a hospital environment. And if contracted, they can be very difficult to treat and in some cases, deadly.
And those 4 can live several hours, if not up to half a day or more, and therefore be in the environment long enough to potentially expose a subsequent patient.
Dr. Debrick Anderson is an infectious disease physician with Duke Medicine involved in this study and says because the problem is so widespread right now, finding a way to get rid of these germs is a top priority.
We don't mean to frighten anybody by saying that, your room is unclean. It's just we're trying to learn more about it.
So we traveled to Durham to see this new technology in action.
The UV actually literally gets down into the DNA of the bacteria and disrupts it to the point where it just literally kills the bacteria. We've actually been able to confirm that finding here just this month.
First, the hospital room is cleaned by hand and then set up so Trudy's UV light technology can reach germs in places that may have been missed.
The light that goes in there bounces all around, and so if it can get inside the drawer, then it'll bounce around inside there and kill whatever germs may be present in there.
We get the remote control of this remote.
Now, you can't be in the room while Trudy is at work, so a remote control is used outside the door.
It will stay on essentially until all 8 of the sensors that are on top of it have received enough reflective UV light to get up to what we're calling an effective dose for the germs that are likely to be in the room.
Okay, thanks. The staff at Durham Regional says they're excited about the possibilities. Researchers at Duke Medicine are about halfway through their study with True-D, and if the results are as promising as they hope, True-D could be cleaning hospital rooms across the country pretty soon. In Durham, Kelly Patterson, NBC Charlotte.
Now, Dr. Anderson says if you're concerned about the sanitation of your hospital room, speak up. Ask your doctors and nurses if they've cleaned their hands, ask how much time was spent cleaning your room, and ask about their cleaning process.